think now more than ever during COVID, we have more appreciation for medical research. And I think we can't underestimate the top talent that we have within Australia, but also with this fellowship, hoping to really do a global search and ensure that we continue to do the very best research. I've been involved with the Institute over 20 years, and I've seen it transform from being, top 3 in Australia, a top institute in Australia, to now top 3 in the world. And it is really incredible. It's co-located with the Royal Children's Hospital. It means we have a campus that allows for greater interaction between researchers and patients, faster translational outcomes, and that's more than other research institutes around the world.
What are the most insidious threats to child health at the moment?
I wish we had more time. If I could just talk about COVID in and of itself, we pivoted pretty quickly at the beginning of the year once it became a pandemic, and developed 80 different research projects, all the way from genomics through to mental health. We've been seeing children arrive at the hospital undernourished. We see what we think will be an emerging shadow pandemic, sequential waves of negative consequences that we think will be months, years, and perhaps generations after the virus is gone. So we're actually launching a huge cohort study in Victoria called Gen V. We hope to roll it out across the country. But we will be studying 150,000 babies and their families, and really looking for more equitable outcomes for children, not just around COVID, but across the board. So we hope this will be a model we can share with the world. We think we're uniquely placed to do it, and we're really excited about the outcomes.
As you say, Australia really punches above its weight when it comes to many areas, particularly when it comes to medical research, though. And with thanks to the Murdoch Children's Institute in particular, what is the view of Australia from the rest of the world, from where you sit at the moment, about the breakthroughs that we're making with COVID and other areas of medical research?
Look, first of all, we created this fellowship because we're obviously very passionate about continuing Dame Elisabeth's legacy at the Murdoch Children's, but also because we know what a great investment Australian medical research is. I mean, living here in the US, I can see we have not historically enjoyed the level of fundings that the US Institute received, but somehow we're still top 3. So it really goes to show the strength of our medical research in our country. And for us, if we can seed research, we just seeded, for example, a trial for the BCG vaccine, which is a tuberculosis vaccine. It's been around for 100 years. It's very safe. We've now rolled it out across 10,000 healthcare workers, across tens of hospitals in 5 countries around the world. Our funding was seeding it, and we ended up getting Gates Foundation funding. But this vaccine, we think, can sit alongside some of the COVID specific vaccines because it shows to boost immunity. So in this pandemic, or God forbid any future pandemic, the medical research that will come out of Australia could have a huge effect and impact on the world.
We've got a 100-year strike rate for pandemics at the moment. Let's hope it continues to be that way. But you have been ambassador for the MCRI for 20 years. What has been the most satisfying breakthrough in that time? Again, I don't think there's going to be enough time for this answer.
I know, I don't know where to start. And I think actually what's really interesting, and I think what I want Australians to appreciate, is that global impact that we have. So, for example, we're doing a project at the moment. We're up for a $100 million grant here in the US, one of 6 finalists, which is pretty incredible, to provide oxygen access to low and middle income countries. Lack of oxygen for babies and children, in these countries means a death rate 7 times higher. So, we're hoping that we can provide that oxygen access to those countries. We're hoping we can roll it out further. And it just goes to show, I think, the global impact that a medical research like ours is having. And it makes me very proud that we can really, address everything that will affect young children, from prenatal, rare disease, which is rare but affects 1 in 12 children globally, right through to sort of helping those children in low and middle income countries.
As a new mother, I can't even get my head around what it would be like for your child to be born with one of these rare diseases. You've met some brilliant minds as you've been ambassador for 20 years at the Murdoch Children's Research Institute. Is there anyone that's really left a mark on you?
I think what's really interesting at the moment is I'm really interested in genetics and genomics, something Dame Elisabeth was also very passionate about and had the foresight to create initially a genetic institute in 1986 when she founded it. But we have a researcher at the moment pioneering globally the ability to create mini organs. So mini kidneys, mini heart, mini lungs, and she's infecting them with the COVID virus so that we can start to see what are the long-term effects of this virus. But it also means for children who, have kidney disease, heart disease, all of these awful, awful things that children are either born with or develop over their lifetime. This is really the future, and I'm really excited about that aspect.